Hello, hello, Shane here. Today I want to share with you some very valuable information regarding top surgery, otherwise known as double mastectomy. I got my top surgery through informed consent. That means I've never seen a therapist, I've never seen a psychiatrist a day in my life for anything trans-related or not. That's just my life, my journey, my travel, my transition. I've never seen any one of these medical professionals. Therefore, I've never received any letters of recommendation. So yes, you can have top surgery in this country without any letters. No gatekeeping at all whatsoever. Furthermore, I did not use insurance to pay for this surgery. Thankfully, I had some help with my family paying for this, but the price is $5,900, period. It is, to my knowledge, the lowest price you will find in the United States of America for this quality of work with no hidden fees. His name is Dr. Kenneth Wolf. He works out of Michigan. The reason why I can assure you that there are no hidden fees are because he works out of his own private practice. He has his own anesthesiologist on staff, and all of the procedures are done in his office, which means you don't have to pay the hospital fee, you don't have to pay the anesthesiologist fee, and you don't have to go to a hospital. Wait, the consultation is going to be right in the same area where you're going to have the procedure, and it's very nice, clean, small, organized space. And his wife, Ginsel, also works there. You may schedule your appointment with her. And when I say there's no hidden fees, I really mean there are no hidden fees. If you have a different body build, you may want or need liposuction around this area. For that, he charges $1,000, so it would bring it from $59 to $69. But if you have a body frame similar to me, you will not need the liposuction in those areas, and the nipple grafts included. I believe if you do not want to have the nipple graft, he'll charge $5,400. And that is it. It is not a penny more expensive. He will include the dressings, the compression vest. He will set you up with all of this. All you have to pay for separately would be medication from the pharmacy, for which he will prescribe. And yes, he will prescribe it out of state. I picked it up at the pharmacy in Vermont, and then I brought it on the plane with me to Michigan. I did not eat any of the painkillers. It was rather painless procedure. I mean, recovery wasn't necessarily easy. It's still a major surgery. But I have a pretty high pain tolerance, and I'm not into medication, so I didn't eat the painkillers, and I was fine. I did develop a hematoma on this side, which was my own fault. Hematoma can happen from any surgeon. Has nothing to do with the surgeon, has everything to do with how you take care of your body while it's healing. And I was spending a week in an Airbnb away from home, and I was just kind of laying in this awkward position. I just didn't have the best help, and the toilet paper in the bathroom was like back here, and I was just like moving a lot, reaching more than I should have, and I mean, if you have a hematoma, you'll be able to tell. It was rather painful. I still didn't need the pain medicine, and when I went up for my 5-day post-op, he recognized immediately. He said, "There's a hematoma on this side," and he just put me under anesthesia again real quick and drained it up and repackaged me up. Had to wear the compression vest for 1 extra week as a result of the second quick surgery, and I got on the plane that afternoon and went home. So of course he did not charge a penny for the second surgery. It was just the draining of the hematoma. That was just very much all included, and I really did not have to worry about anything after paying the initial fee. That's it. And the reason why he offers this price with informed consent for anyone, you don't have to be on testosterone, you don't have to have any letters, because he wants it to be accessible, because he's a good guy, his wife is a good person as well, they're good people, and they just care about offering care. And you know, the life of a plastic surgeon, if someone walks in and wants to have a breast augmentation, they don't have to have a letter. So if I walk in and I want to have a reduction or a mastectomy, why should I have to have a letter? In his opinion, you shouldn't, and there's no law saying that you should. So that was one of the main reasons why I chose him, because I felt comfortable working with somebody who I know sees me as a human and respects my wants more than just a patient who's doing something. It's like he's choosing to do this for the trans community to make it easier for us. So if you don't live in Michigan, you'll have to pay for a week's stay in Michigan. I used Airbnb. I got a really good deal compared to any of the hotels. It was a fraction, say a fifth of the price, and it was big and comfortable. And that's it. And the plane, and I could show you my results a little bit closer. My nipples healing a little weirdly, but that's not Dr. Wolf's fault. Again, that is every person's body heals differently, and this is something that's extremely important to know. Choosing to go in for this major surgery, you may not have the exact perfect results that you're looking for because everybody's body heals differently. Also, worth noting, these are my scars. I'm not even 1 year post-op. I'm less than a year post-op, and I got my surgery at the end of April. It's currently January, so March to June, July, August, September, October, November, December. It's only the 8th month. I've not done any scar care at all whatsoever. I do not massage them. I do not put the silicone strips on. I don't moisturize them. I just do nothing that I'm supposed to do for them. I don't mind bearing the scars. I don't need them to disappear. And then I started working at UPS briefly at 3 months post-op, right when I could, which was a lot of reaching and stretching. So this part of the scar is much lighter than this part of the scar. That's because I did so much reaching and stretching, which was, again, my choice, my decision. With Dr. Wolf, you can expect this shape every time, which was something that I really wanted. That was a very desirable pattern for me, also part of the reason why I chose him. So you can expect proper placement and shape every time with Dr. Wolf. And you can check Instagram, hashtag Drwolfswolfpack, and you will find plenty of people who are showing you the same pattern, the same procedure, the same result. They will attest to his bedside manner, and so if you're worried about taking the plane into Michigan to have the surgery, both before the surgery and after the surgery, you go to the Detroit airport. I had a pretty good time. It wasn't that big a deal. On the way in, of course, there's nothing to it. I mean, just past typical dysphoria, having to go through the scanner. And then on the way out, you can't lift your arms to go into the scanner again. You'll be all wrapped up, and again, you can't lift your arms over your head unless you like really want to mess yourself up. But he writes a letter to TSA, and they excuse you from that, which is great, so you really don't have to worry about that. The TSA is the TSA, we do what we can do to get around them, but I was very sick, actually, because anesthesia does not interact well with my body. This is, again, extremely personal. It doesn't matter what surgeon you use. If your body reacts this way to anesthesia, your body's going to react this way to anesthesia. If you are unaffected by it, you are unaffected by it. This has nothing to do with the surgeon. I didn't take the anesthesia well. I was sick, vomiting, feeling the most ill I've ever felt in my entire life directly after the surgery, the first time, and after they drained the hematoma. But regardless, once you go to sleep, you wake up, it's completely gone, 100% gone. It's just the anesthesia. And that's just because they're pumping this thing into you that's just foreign from your body, and people's bodies handle it differently. So being very sick on the plane, I still got through TSA. I was vomiting. I had a vomit bucket. It was pretty gross, but they still let me on the plane. I asked to be in the back. I sat in the last row by the bathroom. And it was miserable, but I got home. The minute I woke up the next morning, it was like it never happened. And then I had this. So it's definitely worth it if this is what you want. So another extremely important A+ thing to mention, Dr. Wolf does not use those drains that most of the doctors use. You know, you're envisioning the drain that comes out from your armpit. It has the tube, it has the grenade-looking thing that fills up with blood that periodically throughout the day you have to empty out and drain physically. He does not use these at all whatsoever. The drains are otherwise known as the biggest source of complications and the biggest source of pain. So not only will you not have to deal with having these drains in your body for a week recovery, you also won't have to deal with them pulling out the drains, which could be very painful, the wound around the drain healing up, which takes longer, and the possible complications from the drain or the drain getting clogged. You won't have to worry about any of that. He doesn't not use anything. It's like a very, very, very like paper thin, literally paper thin sheet of plastic that's only about this big, a little long, and it just like it was in this scar. It was just inside of me, this like strip of plastic, and it was just very gently guiding any extra blood or ooze out through that little strip of plastic into the gauze that was wrapping me up. So it was a very minimal amount. If anything needed to come out, it could just very easily come out. And then during the week reveal, the week after, 5 days after reveal, when he takes it out, checks everything out, he just slides it out. It comes out with the wrapping. You don't even feel it. You don't even feel it at all, I swear. It was kind of creepy, because you're like, ooh, something's sliding out of me, but, like, you don't feel it. Another big thing to mention, I have no numb spots anywhere on, maybe here, like the tiniest bit, right under the snipple in between the scar. I feel it. It just feels slightly different than like here and here, so it's not completely numb. The scars are not numb. The nipples do have sensation. I have like dry skin on the end of them. I'm not really sure what's going on, so that's like the part that's dead doesn't have sensation, but the outside does. And I've never asked anyone about it. I'm sure I can get it fixed up at some point. But no numb anywhere here, no numb anywhere here, no numb anywhere. So that's really great. I mean, if you go with a substandard surgeon, you might wind up with numb spots and just a pattern you may not like. Of course, doing a research is very important, but Dr. Kenneth Wolf, he may not be as well known as some of the other top surgery doctors out there, but in my opinion, he's the way to go, even if you have to take a plane, which I did. I mean, there's only one doctor in the state of Vermont who does this surgery, and he requires letters and all sorts of nonsense, so I was just, like, not interested at all. So for me, I was gonna, either drive to New York or somewhere, take a plane anyway, but I didn't want to drive. I'd rather take a plane. I'd rather go to Michigan. I'd rather know what I'm getting into. No extra fees, no nothing. He'll answer your questions. He's a kind, genuine guy. And the whole thing, it was like super quick. I was in there. We talked about it. He put me under. I was done. I was out. And you know what? That's all I have to say about that. I'll give you a side view before I go. And yeah, I took my shirt off and went in the sun that summer. Like I said, I did everything you're not supposed to do for the scars. So my scars are a little dark, but I totally did that to myself. You can go on Instagram and look up someone like Creating Thomas, and you can see how proper scar care regimen will make the scars disappear. I mean, I can't even believe how much his scars have faded already, and but like, he takes care of them. He puts the time and the effort into it. If that's important to you, that's something you're gonna do. That's not something that I did, and I'm not mad at myself for not having done that. I'm proud at him for having done, but that's your own prerogative. If you want that, you do that. You have to put in the work, just like with everything else. Thanks for listening.